Welcome, everyone. We'll start in a moment. Hey, welcome. Thank you all for joining today. We'll go ahead and get started. I'd like to welcome you on behalf of the Office of Oral Health to our February 14th virtual project directors meeting, School Dental Programs, Integrating Care Coordinators and Community Health Workers. Happy Valentine's Day. The oral health team did want to send you all virtual chocolate and flowers, so I hope you're enjoying the day and that you get a lot out of the presentations today and the support across the state. So today's objective is for local oral health programs to learn how to leverage the community health worker benefit for oral health, strategies for finding resources and partnering with community-based organizations, and Medi-Cal program updates. We encourage you to ask questions in the chat and use the raise hand feature. We really want to hear from you and make sure that you feel like you have an understanding of what you need to work in this space. This is the second part of a two-part project directors meeting, and we appreciate your engagement last week in part one, best practices for maximizing COA success. It was a great dialogue and discussion, so thank you all for the excellent questions. And if you have not already filled out the evaluation survey from last week's meeting, please do so. It really, really does help the Office of Oral Health plan future meetings. And at the end, we'll put in a plug for helping to plan the next PDM. So stay tuned for that and be thinking about if that's something you would be interested in helping out with. So I would like to welcome each of you as local oral health program leaders and staff. So we invite you to include your organization in your Zoom name. And we also would like to say hello in the chat. So if you can include your name and your program county in the chat, you can also make it fun and put down your favorite Valentine's treat if you want. But it would really help us help the new staff know who is who. So again, your name, organization, and favorite Valentine's treat. So welcome. We also encourage dialogue for any questions you may have for other LOHPs. So as people start to fill out the chat, you can just see who's who and see if there's anyone you have questions for. So the agenda and speaker bios are available at the registration website. So we'll drop that in the chat too once the introductions slow down. The speaker slides and the meeting recording will be made available after the session on the COTAC website. We'll also be sending out an evaluation after the meeting. We do want to drop the speaker bios link in the chat so that you can follow along and see more about the wonderful backgrounds of our speakers today. So all of the details will be there. And then I'd like to just open up the agenda and so you have a sense of what we're covering today. So we have an action-packed meeting and we'll hear first about leveraging the CHW benefit. We'll hear some timely updates on the Medi-Cal dental work around this topic. We'll also learn about strategies for care coordination. And then we'll have some local examples. We're really excited to hear how Santa Barbara and Sonoma County are putting this work into practice. And we have set aside a good amount of time for question and answers at the end. And we'll also be asking you some questions too about how you're working in this space. So we're really looking forward to the interaction today. And with that, I would love to introduce our first speaker. Eileen Espejo is the Senior Managing Director for Health with Children Now. And I've heard there will be a test on some of what she covers. So we're excited to hear from you, Eileen. Thank you so much. I'll turn it over to you.
Great. Thanks so much, Lindsay. Good morning, everyone. Happy Valentine's Day. Happy continued recovery day for those of you who are Niners fans, myself included. I'm going to go ahead and share my screen and get this onto broadcast. Here we go. All right. It's nice to be back with you all for another project director meeting. Today, I'm going to talk about something that I actually talked about at the Oral Health Summit last June, for those of you who had attended. So before I dive into that, just wanted to give you that disclaimer. Some of these slides might look familiar, but I do have some updates. And I'm coming to you with a couple of hats on. One is that Children Now is tracking implementation of this benefit because we know that this is a great opportunity for community health workers and that workforce and the benefit itself to be used to improve oral health outcomes, of which I lead that work for our organization. I'm also coming to you today as co-chair of the California Partnership for Oral Health. And this is a group that you all heard about at the summit as well. Leveraging the community health worker benefit for oral health specifically as part of the California Oral Health State Plan. And as part of the partnership, there's also a community health worker work group that I am a part of. So all to say, there's a lot that's going on in community health workers, and I think there's a real great opportunity for all of us to really make sure that this is something that is helping to advance and improve oral health outcomes for everyone in our communities. Okay, so this is where this might be a little bit of deja vu, but I just wanted to remind people that per the benefit that went into effect in July 2022, these are all the different services that a community health worker could address through the benefit, meaning that if a community health worker were to be reimbursed by Medi-Cal, these are all the things that they could get reimbursed for addressing. And I bolded the first four, which I think are most pertinent for local oral health programs and for oral health itself. So this is all described in the Medi-Cal provider manual. You'll see the link there. I believe Fatima is also on to be dropping links as well. So we're switching roles from last week's PDM. So again, these are all the services that a community health worker may address. In terms of covered services, there are two in particular that I think would be of most interest to this group. That's health education and health navigation. And as that link describes from the manual, this could include for health education, coaching and goal setting, things that will help improve that beneficiary's health or their ability to self-manage their health conditions. It also includes health navigation. So providing that background information, training to help that member access healthcare, understand what they can be doing. It also means to help connect them, if necessary, to other community resources. It might be that they lack transportation. So it's giving that Medi-Cal member the phone number to call or to say, here's where your managed care plan can help provide that transportation benefit. So those two things in particular, I think, are something that this group could help to leverage to make sure that community health workers are activated to both provide health education and health navigation. It also includes things like screening and assessment and individual support and advocacy. So really important to understand that for screening and assessment, it needs to be something that does not require a license. So any kind of screening and assessment that a community health worker can do, it just needs to make sure that that doesn't require a special license in order to conduct whatever screening and assessment that they might be able to do. In terms of individual support and advocacy, again, it's just to help that beneficiary prevent the onset or exacerbation of a health condition. So in this case, think about a cavity that might have been identified, or if there were black marks from a screening that happened to occur. Just making sure that that parent caregiver of that child understands what they can be doing to make sure that that child is connected to the correct provider to help restore that child's dental health. Currently, these are the CPT codes that can be used by a medical provider who activates the community, that could be used by a community health worker who is activated by a Medi-Cal provider in order to bill for the services that they're providing. So these are the 3 codes. You can see there's various descriptions, various lengths. It depends on the number of patients that they're seeing, but these are what are in existence today. There are also modifiers that can accompany these CPT codes, just to distinguish that this was work that was done by a community health worker, and that's what they're seeking.
Okay, yeah. And then click on that.
NMC, oh, there we go. Okay. Okay. So I'm going to spend a little bit of time on this slide because it's a lot. There's been a lot that actually has happened since the last time I connected with you all from last June. But you might have heard, you might be aware that the current community health worker promotora representative certificate and training has been put on hold. This was a webinar that the Health and Human Services Agency held, I think it was in December last year, to talk about how they are bringing the training and certification program that had been initially released. They're bringing it on the road to get input from community health workers and this new workforce themselves, because they realized that they needed to do some improvements to the certificate and the training program. They meaning Department of Healthcare Services and the Office of Healthcare Access and Information, so it goes by HCI. DHCS and HCI are bringing their training and certification program back on the road to get some input, make improvements, really want to understand what the barriers are for community health workers now to want to take the training and certification program, to want to be able to bill for the benefit, and really to help increase uptake of the benefit ultimately. That said, that's the only thing that's on hold. The benefit as it exists today, it still can be leveraged, still can be used. It's just that training and certification program that's been put on hold. There is an all plan letter that references all of this, but currently that's where we're at with the benefit. And what that means is that still today, any community health worker, promotora, representative that's seeking Medi-Cal reimbursement just needs to demonstrate some minimum qualifications. This is all part of all the links that Fatima is probably sharing, including, having lived experience, and that this is the important part in order to be reimbursed, is that they're supervised by a licensed provider, clinic, hospital, CBO, or a local health department jurisdiction that has that NPI number in order to make sure that that community health worker can bill for their services that they're providing. So in between this right now, I'm going to ask for the poll to be brought up before I go to the next slide. And this is just asking, have you heard yet from your medical managed care plans on how they are educating their provider networks and their members about the CHW benefit? So this does harken back a little bit a week ago to when Fatima did her great presentation on how Medi-Cal managed care plans can be leveraged to help support your work. This is something else that the Medi-Cal managed care plans are supposed to be doing. This benefit's been in existence since July 2022, and they are supposed to be talking to their provider networks as well as educating their Medi-Cal members about the community health worker benefit that it exists, and also that ways in which they can access it. I can see we got 61% so far. I'm gonna give it, I think we have about 50 more seconds to go. Oh, it's going up. Okay. We got 75% participated so far. I'll give it 15 more seconds and then we can share. Okay, I'm going to go ahead and if we end the poll, the results will be shown, correct? Okay. So it sounds as if, it looks as if, very highly, we haven't heard yet from our managed care plans on how they're educating their provider networks and their members about the community health worker benefit. Or we don't know. And then coming in last place is yes. So I'm going to stop that. And I'll go ahead and keep sharing my screen. Okay. All right. So this next slide, I think what I'm trying to do here. Here we go. Is what can I do? So for those of you who said no, answered no, or for those of you who said don't know, we would invite you to ask your managed care plans if and how they have been educating their provider networks and their members about the community health worker benefit and how to use it. I would hope there's a really strong chance that maybe your county health executive has already connected with your Medi-Cal managed care plan about this. So maybe that's part of the no or don't know part of how people answered. So I would encourage you to also check in with your leadership first to also ask, have we talked to our managed care plans about the community health worker benefit? You'll see in that second bullet, you could also request information and say, how can I help you help get out the word about the community health worker benefit? And to also ask, how does this connect? How do we connect? How do we get community health workers to help connect our members to care in a fee-for-service dental delivery system for those of you who are not in Los Angeles or Sacramento County? If you don't know your Medi-Cal managed care plans, I think this link was also shared last week, but you can also go to the directory, which is listed at the bottom of this slide. Bonus, because I always like to throw in bonuses, is that when I have time, just again, a reminder of what managed care plans are also required to do as part of their contracts, which is also reflective of a state law that passed in 2016. This is AB 2207, the link at the bottom, and Fatima is probably going to drop it in the chat as well. But Medi-Cal managed care plans, they are required to do these three things. They're required to provide dental screenings for every eligible Medi-Cal member. So children and adults who are enrolled in Medi-Cal, they have to do this at the initial health assessment that is provided to that Medi-Cal member. They're also supposed to ensure that that eligible member is referred to an appropriate dental provider. And they're also to have hired plan liaisons who are available both in dental managed care and dental fee-for-service to assist with referrals to health plan covered services, which includes dental. So this is all just taken straight out of statute. So another thing you could ask could be, could you also remind me how you are complying with AB 2207? Or could you remind me, managed care plan, about the dental providers that you're referring these Medi-Cal members to? It could be that you might also have an updated list, or it might be that you're also referring them to the Smile California website if they're having trouble making these referrals. So all to just really push that partnership with your Medi-Cal managed care plan, because there are oral health related things that they are supposed to be doing on top of everything that Fatima had shared with you last week. The one thing that's also not on this slide, I'll say, is making sure that fluoride varnish is being both applied and reported for children under the age of 6, because that is actually part of, it's called the Medi-Cal Managed Core Set of Measures or something like that, that primary care providers are to be reporting fluoride varnish that they are applying to children under 6. And it's part of something that's also reported on the Preventive Task Services report, which was something else that Fatima had touched on last week. So again, another opportunity to check in with your managed care plans about what they're doing, in addition to the community health worker benefit. And then last but not least, these are all links from which I pulled for this presentation. If you're interested in getting updates, you can email the HCHI email address that's at the bottom of this screen. You might know community-based organizations that have been thinking about leveraging the community health worker benefit. So if they're not already plugged into any of this, I would encourage you through your oral health coalitions or through your other networks that you have to start getting the word out and seeing if and how they might want to be engaged in really leveraging the community health worker benefit for oral health specifically. And that's my last slide. And I think you all know how to reach me, but in case you don't, here's my email address. And I will stop sharing. So thank you so much for your time.
Wonderful. Thank you so much. So I know we have questions flowing in the chat. So for right now, we'll move to our next presenter, and Eileen, as you can, and I know Fatima, you're also responding in the chat. You can get to it that way, and then we'll also have time to come back and answer the questions live too. So I'll introduce our next speaker. We're so happy to have Adriana Alcala Bashara with us today. She's the Division Chief for Medi-Cal Dental Services Division Department with the Department of Healthcare Services. And we're looking forward to your update, Adriana. Thank you.
Thank you so much. All right, so I'm just adjusting my computer back a little bit. I lost my spot for a moment. All right, back to it. So good morning, everyone, and thank you again for your attendance today. I'm going to go ahead and present on the title of my presentation is the Medi-Cal Dental 2024 updates. So on the agenda, we'll go ahead and move on over to the next slide. I am going to be discussing the care coordination, community health workers, as well as additional Medi-Cal Dental Services Division updates. So the first one that I'm going to go ahead and jump to is our partnering with care coordinators and community health workers. So we'll go ahead and go on over to the next slide. Thank you. All right, so for care coordination, we just want to make sure that folks are aware for the dental care coordination component, there has been a longstanding dental coordination piece that has been available in the fee-for-service as well as the dental managed care space. So today, members can access Medi-Cal dental care coordination services by contacting our telephone service center, 800-322-6384. And the care coordination services allow Medi-Cal members to call and gain access to extended dental services with the direction and support of telephone service center representatives. So at that telephone service center, they're able to locate a general dentist, specialty dentist, or clinic that offers dental services. They're able to get warm call transfers to assist with appointments, translation services, and also American Sign Language services, as well as transportation assistance for non-medical and emergency medical care. With that said, our dental managed care plans also do provide the same services to our members for those that are enrolled in dental managed care plans. So that is a high level of what the historical landscape has been for our care coordination services in both of our fee-for-service and dental managed care spaces. We will go ahead and move on over to that next slide. And really at this time, what we're looking to do is reimagine how we accomplish dental care coordination. So presently, the department is in the final stages of including an online form for our membership, wherein any member or their representative or member of the public, such as a school nurse, community health worker, would be able to put in a dental care coordination form for the member to request the services. And through there, we would be able to aggregate the data to understand the needs of our members best in where the members' needs are. So some of those fields and highlights include the member's name, their legal guardian for contact purposes. They also have gender, the tier need for the member. So for example, if the member just needs orthodontic services, we do have that specified for a tier 1, tier 2, a member not having a dental home. Tier 3 being the appearance of caries or other periodontal disease or issues noted. And then 4 is the member is in pain due to dental needs or has a profound urgent need visible, such as an abscess. And so in those instances, we are able to triage the members and be able to secure them appointments with providers throughout the state of California. We're also going to be able to better aggregate and gather data based on the needs of members to be able to understand and better address the oral health needs of our members. So this is something that we are very excited to have coming out, actually should be released in the next couple weeks. And this will be a tool that will be able to be used for, even our hygienists. So in our state plan amendment today, presently, we do have for hygienists the requirement to refer a member if they are not with a dental home. And so this is a tool that is an additional tool for hygienists, for example, to be able to connect members better to their dentist, to a dental home. So that is on the horizon, and we are very much looking forward to those announcements in the weeks to come. So we'll go ahead and move on over to the next slide. Our community health workers and oral health specialty certificate. So presently, as this next slide, we'll go ahead and transition on over to that one, discusses, we are currently working on a policy to implement the CHW policy for Medi-Cal Dental. The codes that were provided in the previous slides, so the 98960s, 98961s, and the 98962s, those are specific CPT codes. So if those are attempted to be billed into the CDMMIS, we would not be able to adjudicate those claims because those are not part of our state plan. So those are specific to medical providers and those that are able to bill for said services in accordance with our provider manual and handbook. Presently, the dental program is working to actually put in place a CDT code for the community health workers. And at this time, we are presently working on curriculum based off of our stakeholder feedback to have a special focus on the oral health needs of members and how to best guide them to connect them to services and understand the best practices for oral health care. So I would say in the coming weeks or so, we are looking to establish our first work group for the buy-in of what the content materials will be for that specialty training. But it will have a special focus in regards to our members with special healthcare needs, early childhood, caries, pregnancy, and other specialty areas where we do believe that there is a significant benefit to being able to have additional training available for our community health workers. The policy will align the Medi-Cal CHW policy that was implemented on July 1. So the rates that you would see on the dental space would be identical to the rates that you would see on the medical. And again, as mentioned, that training program is presently underway. So we do look forward to having additional information in the coming future for our stakeholders as well. And that will also better be able to illustrate and outline where we have dental fit in as a whole within the Medi-Cal program. So that is underway and presently something that the team is working very, very quickly on to try and implement as soon as possible. All right, so moving on over to our next slide. We also have the CalAIM 1915 waiver undergoing. And so this is a very big focus on prevention and community presence as well. We, in this particular program, obtained federal approval through our CalAIM 1915B waiver special terms and conditions to be able to outline and best understand our performance measures and benchmarks to assess DMC plans as well as the fee-for-service landscape to establish an updated actuarially sound payment withhold methodology and link those to performance improvement targets. So as part of that 1915 waiver, we conducted a parity evaluation to assess the performance of our DMC counties, specifically Sacramento County, and how it compared to the fee-for-service delivery system on a statewide basis. And based on those additional evaluations, the department took additional action in regards to the parity measures. But specifically, when it comes to the evaluation for the fee-for-service and dental managed care components, there were metrics that were outlined on there, and those included the annual dental visits, the preventive services, use of sealants, and the Medi-Cal dental reports. And so for the use of sealants, preventive services, and annual dental visits, those are ones that we collectively look at and monitor, whether it is the specific provider, like a sole proprietor office, as well as our safety net clinics. That's all data that is aggregated and used from our dental managed care plan membership, as well as our fee-for-service membership, based on all encounter data that we do receive in from our plans and our claims. So with that said, we can go ahead and move on over to that next slide for just our general updates, the state of the Medi-Cal Dental Services Division, and where we are moving towards in 2024. So we'll go ahead and start first with teledentistry policy, and then we'll kind of go into some of these other ones at a high level in the next few minutes to come. So starting on the next slide for teledentistry. For teledentistry, we have had a long-established teledentistry policy that was implemented approximately 2015, and it does account for synchronous and asynchronous transmissions for the teledentistry. We have submitted a survey to all of our provider communities to best understand how the provider communities are using the teledentistry to provide dental services. And what the department envisions is being able to provide that information for our membership to be able to best address the needs of our members through another modality. And so specifically, some of the questions that we're asking are not solely, do you practice teledentistry or not, but rather, do you establish patient care through teledentistry? Do you use teledentistry for emergency services? What are the type of services in which the office uses the teledentistry to best inform our members to be able to make a decision about the type of services and how they want to receive their services as well to promote the best access available for our membership. So that is something that we do have underway. And we are also very excited to announce that there have been 2 dental managed care plans that have implemented teledentistry as alternatives to emergency department visits. So that is essentially where our dental managed care plans are able to receive a telephone or video call from their membership and are able to connect them not only to a doctor for the emergency instance, but have a follow-up visit for them to be able to get them the services they need for long-term oral health care. So that is something that we are also looking at to explore in our fee-for-service side as well for our statewide implementation. The surveys are our first step at getting towards that mark. And we will go ahead and move on over to next slide. The department is also presently working on a dental managed care procurement. So for the dental managed care plans, we did release the new request for proposal on August 3rd, 2023. We did release the Administrative Bulletin 5 on November 8th, which just had additional information about some of the questions that were posted and clarifying points for the dental managed care procurement. And our final question and answers addendum was released on 1/29. So we do anticipate that all bids will be due and coming in on the 22nd, wherein the department will then start the evaluation process to select the dental managed care plans for the new construct of our dental managed care program. We are very excited about the opportunities that are coming out through this new dental managed care procurement. We do have an oral health equity transformation program. That is one that I do see as unique actually for Medicaid programs in the United States. I have not seen one actually that has a specific emphasis for oral health equity and transformation in any of the other programs thus far. So we are very excited for that. We're very much looking forward to collaborate with other states in this space to be able to best deliver those services for our members and support our providers in the provision of those services as well. All right, so we'll go ahead and move on over to the next slide for the dental managed care contract. These are just a little bit of quick bites in regards to what this managed care contract has. 54 months operations. Again, as mentioned, the Oral Health Equity Transformation Program. It does have a greater amount of accountability and commitment for compliance. So specifically, we have a lot of self-reporting for the plans to be able to understand where those contract shortfalls may be to best address them on a go-forward basis. And then, of course, in collaboration with the state for any of those targeted interventions that need happen. In addition, we also have a very much increased focus in the integration of medical and dental care. Some of the performance targets that we do have and look at for monitoring do include essentially a member's visit to their primary care physician and whether there was a follow-up dental office visit, the application of fluoride varnish in a dental setting versus a combination of a dental and a medical setting. There are a number of areas in which we have really tried to further integrate the medical and dental spaces collectively to be able to best provide services for our membership. So again, that is one that we do have on the horizon. And just for clarity, these are contracts for the Sacramento and Los Angeles counties. Next one we have is provider trainings. So part of the other recognition that we have from a grassroots effort as well is understanding the needs of our providers for content that aligns us best for what Medi-Cal's policies are and the understandings of them. So we do have provider trainings that are now available in person and on demand. So at any time, a provider is able to take our introductory as well as our advanced seminars. We do have some upcoming trainings that actually one has just been released for scaling and route planning. So we do have that one that is available for our provider community, and our adjudicators at Medi-Cal also review the content to ensure that we are aligned as a team in making sure that we are understanding the policies and adhering to them from a compliance perspective as best as possible. And then in addition, for many of those, including the periodontal training, that does include free continuing education credits for our practitioners as well. Okay, so moving on over to the registered dental hygienist updates. Specifically, we are very excited to announce that we have updated our state plan amendment. So RDH, RDHAP, and RDHEFs can enroll in the Medi-Cal dental providers portal. We call it the PAY portal, and the providers are able to, as long as it is consistent with their licensure, bill and render in accordance with their licensure. And so that does allow for additional opportunities for our provider communities to be able to enroll. We also did have the an update in collaboration with the California Dental Hygienists Association to, in the past, it would say that a member would have to have a contract or an affiliation with a Medi-Cal dentist. And what we essentially did is we aligned it to the Business and Professions Code of what those contractual requirements are. And then we stated that if a member did not have a, in our provider manual, we also do provide that if a member does not have a provider dental home, that the registered dental hygienist just essentially refers them on over for that care coordination. And our dental managed care plans or our call centers will take it from there. We will work with the member to connect them and establish them with a provider for an appropriate dental home. And then with that, we will go ahead and move on over to children's presumptive eligibility. And so with this one, just to wrap up, we also are working on presumptive eligibility to have the qualification standards for the presumptive eligibility, the historical presumptive eligibility to be applicable to dentists. So our dentists will also be able to determine if a member can be presumptively eligible for 60 days before they're required to go into county. And this is exceptionally a benefit for offices that provide emergency dental services. So with that, I will go ahead and move just over into one more slide for the provider enrollment. Last plug, I promise. And that is just in regards to the concierge services that we do offer for all of our dental providers that are looking to enroll in the dental program. Recognizing the change that had occurred in the PAPE system, we do know that that was a change for some. So I just wanted to also make sure that folks were aware that we also do now have a service available for any interested dental providers to be able to enroll with the assistance of our historical Delta team into the Medi-Cal dental program. With that, thank you so much. I know there was a lot of content in there. Apologies for going over just a little bit. And thank you again, everyone, for your time today.
Great. Thank you so much for covering all of that. And we have a dialogue going in the chat about some of the details of the CHW benefit. So Adriana, it would be great to have your perspective there while we move to our next speaker. And thank you, Eileen. I see you've been, and Fatima, you've been filling a lot of these questions. So thanks for that. So we have one more presenter before we can take a moment to breathe and process all the great information that we're hearing. So I would like to introduce Bahar Amanzadeh. She is the Care Coordination and Sustainability Specialist with the California Oral Health Technical Assistance Center, and she is an Assistant Clinical Professor with the UCSF School of Dentistry. And we're looking forward to hearing from Bahar about care coordination. Thank you.
Thank you so much, Lindsay, and hello, everyone. Happy Valentine's Day. Amazing presentation so far, and I'm following these two amazing speakers to talk about crafting seamless dental care coordination, effective strategies from on the ground kind of programmatic level. Next slide, please. So I will be covering the overall definition of care coordination, and then focusing on dental care coordination flow and timeline, especially as it applies to the school dental screenings or after receiving COHA forms. We will talk a little bit about training of dental care coordinators, and then tracking the progress of the dental care coordination and how you set performance metrics for your work. And at the end, communication with the parents and guardians. Next slide, please. So before I delve into this, I want to just explain that these slides and this information comes from my experience on the ground with different programs, especially the one in Alameda County Healthy Teeth, Healthy Communities program that I had the honor to design and form those community of dental care coordinators on the ground. So whatever you hear is from different programs I have been part of. So when it comes to the care coordination, here is one definition. Care coordination is a deliberate organization of patient care activities between two or more participants, including the patient or client, involved in the patient's care to facilitate the appropriate delivery of healthcare services, right? So we are moving towards the improving the delivery of the healthcare services, in this case, dental care. However, the way that the activity gets done in an ideal form of it needs to be patient and family centered, and it's a team-based activity with different systems. It's designed to assess and meet the needs of the patients while helping them navigate the system, especially in this case, dental care system. The underlying goal of that, though, is the empowerment and building motivation and self-efficacy in the family and in the patients. So while we are helping them navigate that, you also want to kind of look at it as an activity that very much is an art, right? So you are working with humans who are having difficulty accessing this care system we are in. So while you're doing this also, you need to know that it involves sometimes determination of where to send the patient next and what kind of information the next agency or the next provider in the line needs to have as you move forward with it. Next slide, please. I like this infographic because it looks at the big picture, is that, okay, when you're thinking about dental care coordination, it's good to know that this hasn't existed the way it is right now. So we need to think about training, and we need to think about what areas our dental care coordinators need to be trained on. So we train dental care coordinators, then rethink the places. And that comes from the understanding that our community lives and works and are interacting with with the system, with the environment, and they're not necessarily reaching out to the dental clinics, right? So the care coordination has to rethink the places in order to really increase the access to the dental care system. And at the end, within the work that it gets done, you create the connected care. Next slide, please. So why do we need dental care coordination? I want to give you, and again, we have talked about this in today's presentations, but kind of having a little focus on the health equity here. Social determinants of health are key drivers of health inequities, especially when it comes to oral health inequities. And the oral health of communities of color, those on low income, minorities, and communities that are impacted by social injustice is greatly impacted by all of that. And this is while those communities also have harder time accessing the dental care. So when you are working with these communities, the approach needs to be rooted in health equity in order to be able to overcome those barriers. And when we're talking about oral health, this is literally in front of your face. You can see the manifestation of health equity on the face of our community. So when you are working with the communities and you're looking at those social determinants of health, some of them were mentioned today, such as language barriers, housing, violence in the community. When a community members is not feeling welcome in a certain dental care setting. All of these are some factors that we need to look at when we are looking at designing our dental care coordinations. So for these reasons, we need that, right? We need dental care coordinations to navigate the dental care system and overcome those internal and external barriers. And also, it's good to know that medical dental providers, one of the drawbacks for medical dental providers to join the program is the low show rate. So by increasing the access and improving the show rate of the patients to dental offices, that is a win-win situation for all involved. Next slide, please. I really like this picture. This is from the Healthy Teeth, Healthy Communities in Alameda County, and it's from the training that we had with this community of dental care coordinators from across the county, from different agencies. As you can see from the facial expressions, they're involved in this. They are really looking into the work, and the work itself was set up for them to really be an early intervention, be family-centered. They were trying to be flexible, and they were coming also with that mindset with this work. The work needs to be relationship-based. And the importance of warm handoff in this work is that you are actually helping the families to get to the next stage of the care. Next slide, please. So who does dental care coordination? We are working on the policies for CHWs to be able to do it more and be able to bill for the services. A lot of you are involved with different agencies, but I'm just going to kind of give you some overview of some of the ways that care coordination, dental care coordination gets done at the moment. Community health worker, promotoras, or representatives, all different configurations of them can do dental care coordination. It's ideal if the dental care coordinators are from the community, are bilingual, and understand the culture. That's the plus. Family advocates, school nurses, or other school staff are really poised in a great place to be able to do dental care coordination after school screening, especially. Federally qualified health centers staff and CHWs or promotoras or representatives who work for FQHCs are also great additions to that kind of workforce of dental care coordinators. And also care coordinators within public health departments who get trained on the dental piece of it. They can be an amazing dental care coordinators because they integrate that into their overall care coordinator activities. Oral health programs have created such positions, maternal, child, and adolescent health, MCH programs, home visiting programs, First Five, WIC programs, Women, Infant, and Children's Centers. Those are some examples of such activities, dental care coordination activities happening. But I would like to also hear from you in the chat of if there are other ways that you understand that your community or your LOHP is involved with the community organization who is doing dental care coordination. Next slide, please. So looking at dental care coordination and kind of delving a little deep into details of that, there are three components to dental care coordination. One part that works with patients or clients. The other component that is around working with dental providers. And the third component that is around working within these environments and with systems that are our systems in public health and dental public health. Next slide, please. So a little more information, a little more details here. So when we're talking about working with patients slash clients, the importance of outreach and education in this work is, I can't overstate this. Outreach is important because, again, we want to be able to identify and prioritize those communities who do not have access already. And also understanding those social barriers health education, health counseling, oral health counseling becomes an important part of this to really empower the communities to be able to improve in the kind of a spectrum of their oral health. Another part of working with patients is building that relationship and rapport. And again, as I talked, empowering them in their process. Assessment is an important part of this part as well. And as we know, again, if it's a community health worker doing this work, they may not be able to do an oral health screening or assessment of the oral health in that level. However, they can have a very simple three questions to ask about oral health needs. Are there any pain, any complaints, any concerns around that? They could also assess the social needs, right? If there are transportation or other social needs that they see that's in their purview to assess and to be able to meet. And then if it's not in their purview, it's still depending on the capacity of dental care coordinators, assessing some of those social needs will help the dental care coordinators to refer the patients to the appropriate social services or other organizations that could help them with that. Another part of this assessment is understanding the urgency of care. So after the dental screening at the schools, you have that information, you have the urgency of care, which is going to really helpful in understanding where to go from there. Another part is the timing and nature of first appointment. So as part of all of these, then the dental care coordinators wants to come out of it with saying, what is the nature of this first appointment? What would be the timing of that? And be able to communicate that with the patient. The second bucket is working with dental providers. It is important to also build relationships with dental providers. I know that some of the dental care coordinators get care coordination happens in the format of giving a referral list or giving the list of the dental providers that the patients can go to. And again, sometimes that's the capacity that is there, but I want to encourage you to go beyond that and be able to provide that connection with dental providers so that you can really create that warm handoff and that connection. So coordination with general dentists, general dental providers, as well as with hospital or specialists when it's needed, that's part of that work. The third bucket is working within the environments and systems. That includes medical eligibility. Again, we have talked about CHW's benefits, working with the managed care plans. All of these are part of that, right? And that helps with the sustainability of this activity. And also working with the schools and Head Start Week, wherever this the outreach is happening. Next slide, please. Thank you. So as part of this work, as you see, there's like, it's a complicated art of navigation among these different components. So for the dental care coordinators, how to prepare for this activity, it's a big part of that. Before you delve into this activity, you want to have a list of active providers in your area ready. You want to know which days, weekday, weekends, you want to know their services that they provide. Do they provide sedation if it's needed for a patient? You want to have that. Which one of the providers accept medical? Do they see young children? Do they see pregnant women? Again, depending on the extent of your dental care coordination, you want to have that list ready. And then you want to update that, right? That could be part of the work that you do with the rest of your department. You want to have in place you want to have your process for admitting the new patients or making appointments figured out with the providers beforehand. And also, what is the process for the warm handoff? How can the communication happen with those providers? Have a point person have answers ready for different barriers. You know your community the best. Those of you from LOHPs, you know the community and their barriers to accessing dental care. So have some answers ready or some point people ready to be referred to. And also have a script ready so that when you're reaching out to the families, to the communities, you have that in front of you, or the dental care coordinator who get trained that have that in front of them. Next slide, please. This is a flow chart that is in the a school-linked dental programs manual at the COTAC website. I know many of you have been on that. And if not, make sure that you look at some of these areas in the care coordination as well as in the evaluation section of the manual. As you see in this flow chart, what happens after the school screening, you look at the dental benefits, then you look at the level of urgency. Next slide, please. Then from that, you will see that depending on the level of urgency, you will see like when you will contact the parent. If they have a dentist, you go with that, how you coordinate the care with the dentist. And if they do not, then you look into the medical eligibility and you look at any special needs. And from there, you do your warm handoff. Another part that you see here is recommending 6 months dental checkups. So if you are working with patients and the families who already do have a dental home, then reinforcing those messages, reinforcing the messages around keeping a healthy diet, keeping the oral hygiene up, and also keeping their dental home so that they have that consistency of care and continuity of care. Next slide, please. So this is not written anywhere as far as the time guideline, but this is my understanding of a lot of programs that have done well, have followed the guidelines similar to this. So depending on the level of the urgency that comes out of the school screening, you want to have some time guidelines and also looking at your capacity of how far you can go. For urgent cases, urgent and emergency cases, for sure, you want to address them right away, 24 to 48 hours. There's some LOHPs that they break that level 3 to level 3 and 4 so that they can look at urgent or emergency cases. I know in the County of Marin, which I do some consultation with, we decided to bring, for example, somebody from the FQHC who was working with us to be there, an admin person, a front desk office person, to help with the emergency cases right there and then after the school screening and be in touch with the parents. So that becomes your priority. And that's why we're putting level 3 up there, right? That's your priority. And then level 2, 1 month after that, level 1, you could, depending on your capacity, send a referral list or within 6 months if you have capacity to do follow up with those cases as well. But of course, level 3 is definitely your priority and level 2. And I would say from my experience, if you are going all the way to do a screening in the school or receive the results of the COA form and you see an emergency case or urgent case, that's our ethical obligation to take care of that, right? We cannot not do that, right? So, and so I just want to really create a focus on that. Next slide, please. And thank you, Lindsay. This is an example of a care coordination flowchart from Alameda County Healthy Communities program. Just wanted you to look at a few different areas that they have added more. So, for example, those who were not eligible to receive Medi-Cal, there was a Healthier Smiles programs to look at the urgent cases, and also having the continuity of care to be part of that flowchart as well as following up with the dental providers. Next slide, please. So when it comes to training of dental care coordinators, again, you want to kind of have them be introduced to the program policies and procedures, understand the oral health preventive strategies and some of the dental terminology. It's really important for the care coordinators who focus on dental to understand that. Understand the role and the skills of community health workers, leadership skills, outreach, understand the HIPAA, the data collection and what applies there. And then, motivational interviewing, other agencies they work with, so on. Next slide, please. These are some examples of the care coordination process tracking, right? So if you are using any tracking sheets, which I encourage you to do so, then you want to have this right there. Contacted the guardians, first attempt, second attempt, third attempt. What was the result? as much as possible, have those results be quantifiable, have areas to mark to make that easier. Discuss the result of the screening. What were some of the social determinants of health that were identified? Were they addressed, right? And were you able to identify appropriate dental provider? Was the first appointment made? The appointment was attended, and then second and third appointment if possible, and then treatment completed afterwards. Next slide, please. As I said, using electronic tracking spreadsheet or other dental referral management softwares is ideal so that you can kind of follow up on those and track that. And having oral health education as part of your process will really reinforce the behavior change and kind of the empowerment part of this work. Next slide, please. So you want to transfer those processes into your performance metrics, into your programmatic evaluation and quality improvement. And we're using this RBA framework here. This is as part of the School-Linked Dental Program manual on the COTAC website. Using the RBA framework, looking at how much did we do, how well did we do, how are we better off, you translate those processes into those. For example, in the outreach efforts, you want to know how many outreach activities were conducted, and then as far as how well the care coordinators that collaborated with the schools and other community partners, and as far as how are we better off, the percentage increase in families participating in a school dental program. Next slide, please. I will let you go through these yourselves, but I just want to bring your attention to this last part around the outcomes. That, as part of how much did we do, you look at number of follow-up appointments that the care coordinators help schedule, as far as how well you look at the satisfaction level. And then as far as how are we better off, then these are your actual end outcome. Percentage of the students that were referred, who attended the first appointment, show rate of appointments, and also percentage of the students who received care coordination, who completed the treatment. Next slide, please. So as you see, establishing rapport and asking permission when you are working with parents, guardians, is a big part of that. And that's a big part of, again, that's why it's important to learn about some motivational interviewing techniques and using that in the work that you do. Next slide, please. This is an example of a script that we used on a grant that I was working on some 12, 13 years ago called Elevate in Oakland Middle Schools. If anybody is interested, we can send that manual to you, which is kind of designed around doing the dental care coordinations in the schools. Next slide, please. So as the last slide, here is just a visual story from SJT program as part of the DTI, Dental Transformation Initiative from San Joaquin County. As you see there, as soon as the dental care coordinators comes into picture, that line of connections appears in the pictures and stays there throughout this process into connection to care and improving oral health. So that's who they are, connectors and facilitators of the health, dental care coordinators. Next slide, please. Here's some resources for you to look through. And again, all of you are amazing resources. A lot of you are doing amazing work around this. So kind of using each other as resources also encouraged. Next slide, please. Here's COTAC email. I want to acknowledge the help of my colleagues at COTAC to their contribution to the slides. Thank you, everyone. And I also acknowledge Alameda County Healthy Teeth, Healthy Communities program for letting me use some of their materials here. Thank you.
Great. Thank you so much. Wow. Thank you. So we are going to transition to a 5-minute break. Feel free to use the time to catch up on the chat. There's a lot of great content. And thank you so much for your responses to the question about who is doing dental care coordination in your area. So we'll put up a timer. We'll come back in 5 minutes and get started with the second half, which is hearing from our local oral health programs. So take a moment to catch up, and we'll see you in 5 minutes. is the Executive Director for the Children and Family Resource Services with the Santa Barbara County Education Office. And Jennifer Rivera is the Oral Health Program Manager with Santa Barbara County Education Office as well. I think I got that right. And so we are looking forward to hearing from them, and then we'll hear from Ariel Thomas Ehrlich, who is the Project Director and Program Planning Evaluation Analyst with Sonoma County's LOHP. So I'll turn it over to Mary Ellen and Jennifer to start us off. Thank you.
Hey, thank you so much, everybody. Thank you for inviting us to speak today. I've been really excited to hear everything so far. It's been a great meeting. I'm going to talk about how we collaborate with community health workers, or CHWs. In our organization, they're known by promotores primarily, but for simplicity's sake, I'll probably refer to them as CHWs. The benefit is CHW/P/R, but for simplicity, that's what I'm going to do. And go ahead with the next slide. So we wear two hats here. We're a nonprofit organization that's a community-based organization, but we're also operating under the umbrella of the County Education Office. So we're government employees, school employees. I'm the executive director of a nonprofit, but I'm also a department head in the County Education Office. To give you an idea, if you're not familiar with where Santa Barbara County is, we're about halfway in your travels if you're going maybe from LA up to San Francisco. We have 20 different public school districts and 10 charter schools and over 70,000 children that are students. So let's go ahead to the next one. We signed a contract last year in April. We were one of the first ones as community-based organizations to provide the benefit. And last fall, we made our first attempt to bill and actually finally received payment in the fall of 2023 for the benefit. So we've been providing services to over 20 years as health linkages. But about 6 years ago, we joined with another department under the County Education Office to form a nonprofit. SBCEO actually has 3 nonprofits. If anyone has ever been to Santa Barbara for our Chalk Festival, Imad Nari, that's put on by Children's Creative Project, was another nonprofit that we have. So we operate under the umbrella of the Santa Barbara County Education Office. Next slide. So in order to collaborate and provide this service, you need to explain the 3 different entities that we have here. So we have the County Education Office, who Health Linkages and the nonprofit has an agreement with to work under that umbrella for infrastructure. And then also we have partnership with the Santa Barbara County Promotores Network. And that's an organization that started over 20 years ago, community-based grassroots organization. So it's the partnership of our department working with promotores that is able to make this happen. So as I said, Grassroots Network, active members in their community volunteer to be part of this group. And they actively promote healthy communities through education, policy change, linking people with resources, health services. And currently we have 65 of their members who are contracted with us through the County Education Office to work on various projects. Next page. They have all skills to provide the services outlined in the CHW benefit. So excited to finally see this benefit come out, because this is really the work that they do out in the community and that they've been doing for so many years. So for us, the way we're partnering with the oral health program is doing education, oral health education. They're also involved in fluoride varnish application, which is a different benefit from CHW, but they've been doing that for many years. And then health navigation. So these are just some of the things. These are people in action that have been out here. You'll see some folks with masks. During the time of COVID, we never stopped working. They were out there in the community providing services. It's a diverse group of people with lived experience who are serving the community. They come from different backgrounds, but they share the same values listed above and share a common language of Spanish. Formosus is their primary language. Some also speak Mixteco and other indigenous language dialects. Family roots in Latin America for most of them are first-generation immigrants. They bring a shared lived experience of linguistic and cultural background relevant to the community that we serve. All the business they conduct is done in Spanish, not English. This includes all of our communication with them as a supervising provider. And about 15 years we've been working together to do this. Next slide. So As I said, I'm just gonna refer to it as CHW, but it's important to know that the P is for promotora or promotor, and the R is for representative. And the broader term then is CHW that includes this benefit for a wide variety of folks. The common factor here is that people have lived experience and that they meet the qualifications in terms of, right now it's their work experience, but also that they have the training and expertise in the different areas that have been outlined by DHCS for that. It's important to know that it's a preventative health services. It's not about being providing treatment. So it's preventative, and it's to promote physical and mental health. We have other programs that are doing mental health benefits. Next slide. So I know we earlier, Eileen talked about the different types of services that are provided. These are the ones that we're doing right now with our oral health program. We're doing the health navigation. That's a new pilot that we've got going on. We've been doing since last spring through the CHW benefit health education. I'm really excited to hear about that new specialty training. We've been doing some of our own specialty training. Jennifer will talk more about that for a number of years, but really excited that something will come out from the state on that. So we have preschool programs that actually do screening, different from our oral health. We do vision, hearing, height and weight, BMI. So we have a lot of different ways we're integrating, but these are the things, health education, that individual support or advocacy that was talked about. That's what the promotoras are doing with our local oral health program. Next slide. This was a new term for us. So the thing that really makes a difference between, CHWs and perhaps other staff that are involved in doing work is the lived experience component. So we found it helpful to explain a little bit about what this means. So it means that they share the same lived experience with the people they are serving. So this gives a common bond which can bring about greater understanding, sensitivity, and rapport. Because of the lived experience, the CHW is often a trusted messenger in their own community and may be more effective with certain populations. So the personal part means that it has happened to or is true for them, this experience. Family means that they may have experienced it because someone close to them in their family has gone through the experience. Could be a mother, father, sibling, or child. This can be all types of different experience, from incarceration to chronic disease and any great number of things. We have a lot of folks that are working in the peer field around mental health and substance use. So this is work that's been done for a long time in other fields. But with promotoras, we're talking about especially that common language, culture, region, and then you put that together with the work experience that we're able to verify because we've been doing this for so long, and then that's how you come up with our ability to be able to start implementing this. Next slide. Jennifer's going to take over now.
So I will be talking to you about the services that we're able to meet and the objectives in a specific with oral health. So this is the fluoride varnish application program that we have in our county. There's 2 agencies in our county that do the fluoride application, and we are one of them. We serve the population of 6 years and under. The fluoride varnish application, it is a billable service. It is not under the CHW. As SPCEO, we have our own NPI and we are Medi-Cal providers, and we're able to bill for this service. Thanks to the collaboration with Promotores, during the fall, we were able to provide the fluoride application to 67 sites that participate. That includes countywide, and we were able to provide fluoride to 1,199 students. The other agency that provides the fluoride varnish, they concentrate in the elementary population, and that is provided by Santa Barbara Neighborhood Clinics, who is a dental provider. The other objective that we're able to meet with the help of Promotores is the oral health education. So when we go out into the 67 sites that we covered, we build a waiting room area where all the class, it's mandatory to come. And during that time, we provide the oral health education services, and we provide a pre and post to make sure that we're able to measure if the service we're providing is making a difference. So during when we go to Head Start, when we go to preschools, this is a service that is provided to all of them. And the oral health education, it is a CHW service that we've been able to pilot test and bill and have gotten reimbursed for. The other piece is the patient navigation follow-up that is now a CHW service. All promotores who do the navigation service do get a training so that they understand who they will be referring to. Right now, currently our pilot test is with the preschools, and those students who were identified with dental emergencies, we are calling to make sure that the parents know that they do have the help for us to make the appointments for them. And once the appointment happens, we do follow up to see if they need any assistance. So far, the Santa Barbara School District preschools have been called, and as of right now, 22 of them have dental appointments that have not started treatment, but they are confirmed appointments that we've done for them. Collaborating also means doing the outreach in the community. This is not a CHW service that we're able to bill for. But it is something that we collaborate with the promotores to do. Promotores in Santa Barbara County take their own training, and once they become promotores, they get specialized training through the oral health program. And during this training, it happens before the school year, so that we have a cohort of promotores who become oral health educators with our team. And during this training, they are trained on how to apply fluoride, and they are trained on the outreach education and how to the proper technique of brushing, flossing, and education that goes out to the community as well.
Okay. It's really important to understand that it takes a number of different partners coming together to be able to successfully implement the services in the community. And for us, these are the partners. So Children and Family Resource Services, as a nonprofit community-based organization, we are the one who is the supervising provider in our county who has started this. And we have a number of other nonprofit partners. I think some of our FQHCs are starting to do this as well. But first, in order to do this, you have to have a supervising provider who's going to employ or contract with the community health workers. And then you have to have a partnership with that local managed care plan. And so CFERS, we're the ones that are the supervising provider that have contracted with our local managed care plan. And we just recently enrolled in the state Medi-Cal program. That was something new. DHCS put out a letter, I believe in January. And so now we are enrolled in the PAVE program. That's new for us, the PAVE portal. So we're excited about becoming a state Medi-Cal provider. You need to have people who are certified as community health workers, and that is a complicated issue, as we talked about, still being determined by HCI. And then there needs to be the funding coming through that local managed care plan who will contract with the providers and pay for the work. And so the responsibility really has been so far on both the local managed care plan and the supervising provider to make sure that people are qualified to provide the services. Next slide. So these are our partners. So our Health Linkages program, we are acting as the supervising provider. Our local managed care plan is CenCal, and then the partnership with the promotores that I told you about. We were the first ones, I think, to contract in our area. We did that in April and then started to provide the services. And as I said, just started to have some billing start to come in last fall. Next slide. I really want to highlight what an amazing partner CenCal Health has been. So I know every county has different managed care plans, and some have multiple ones. For us in Santa Barbara County, there's just one managed care plan right now, and that's CenCal Health. They are also the managed care plan for San Luis Obispo County. They're a nonprofit, and they cover over 200,000 lives with insurance. And so they've been an amazing partner who've actively pursued a way to make this happen. and to get started in our community. I was just recently elected to chair their community advisory board, and we have 2 promotores who are also on that board. Next slide. So some of the things that helped us qualify for this, first of all, we needed to be a community-based organization. Clinics, health departments can also do this, but this was our route in. So we didn't do it as SBCEO as a school district. We did it as a community-based organization. We already had the administrative structure in place to track this because we've been doing this type of work for 15 years, and we already had experience billing Medi-Cal for some services through the SBCEO's MPI number for fluoride varnish. So we had a little bit of infrastructure in place there. And then what we did was apply for our own MPI number as a community-based organization specifically for the CHW benefit. We then contracted with the local MCP, and that was a heavy lift to do that. We had to put a lot of things in place to make that happen. And then just recently, this past week, we enrolled in PAVE to become a state Medi-Cal provider. Next slide. Slide, yeah. So these are kind of the next steps in process. So with CenCal, we have a roster, so we're verifying and certifying CHWs. Again, I know HCI has not come out with that guidance yet, so we're doing it ourselves based upon the historic nature of training that's gone on for core training for promotores, how they've certified themselves. And then also what we found in the APL, the requirements that DHCS put out, we're making sure that the training was modified to ensure that all of those components are being met. Infrastructure within ourselves right now, it's just me and my administrative assistant putting together that billing, and then expanding the program. We're hoping to really scale things to a larger level. Want to complete that pilot with oral health we have around the health navigation. Our next practice case, we have a Medi-Cal enrollment program, and so we're looking to start billing for the redetermination and renewal work that we're doing. Next slide. Thank you so much for having us.
Wonderful. Thank you so much, Mary Ellen and Jennifer. Really appreciate the overview. We'll turn it over to Ariel. Welcome.
All right, I think I'm good to go. My Zoom just kicked me out and then restarted. So hopefully that's what you guys just said, and I don't have any other technical issues. Okay, thanks, Mary Ellen, for the thumbs up to let me know I'm on the right track. So thank you so much, everyone, for having us. It was great to hear from our colleagues out in Santa Barbara and the great work you guys are doing. Sonoma County, we're taking a different path. We do not offer any direct service through our, we are not a Medi-Cal provider, at least our program is not. And so what I'm going to talk about is more on that systems level side, and we have actually hired a community health worker within our teams. That being said, a lot of what I'm going to give you is speculative because we've recently hired a community health worker, and this has been a shift in our team. So I'm happy to answer questions as best I can. So moving to the next slide. Great. So I wanted to give you guys a little bit of environmental background on Sonoma County and why our community was really well poised to hire a community health worker for our team. So first of all, back in 2017 to 2020, the Local Oral Health Project in Sonoma County received a Dental Transformation Initiative grant, or a DTI grant. This was grant funding that paid for a variety of work, but it paid for the integration of community dental health workers, which are similar to community health workers, but they focused exclusively on dental within all of our FQHCs across Sonoma County. And then it also paid for training of 33 community health workers at Santa Rosa Junior College, which is our local community college, between 2017 and 2019. That program is no longer in existence since 2019. Doesn't mean it couldn't come back at some point, but at this current time, it's not operating and has not operated since 2019. We more recently, the county received a CDC Community Health Worker for COVID Response and Resilient Communities, or a CCR grant. This was grant funding to the Department of Health Services to implement training, staff implementation or staff embedding in local projects, as well as sustainability of a community health worker workforce across Sonoma County. This is funding that is currently available to the department through 2021 to through this year, 2024. The grant offers a lot of services, but those that we have utilized personally as the local oral health project include the free ongoing and initial training of community health workers. This is through the City College of San Francisco's Community Health Worker Certificate Program, which is only available in English and has graduated 32 individuals interested or currently working as a community health worker, and it's enrolled an additional 28. The program also offers a Spanish language course through El Sol, which has graduated 29 community health workers and is currently enrolled 25. There also was identified as a need for community health worker supervisors. There were a lot of folks who were really excited to hire this workforce, were really excited to work with these newly trained staff, but really needed some background and better understanding about how to supervise this type of workforce and what really the strengths and the goals for having a community health worker really was, so that they were properly being utilized. And this has had 13 graduates, including me, one of the LOHP staff members, had the benefit of attending the first cohort. So really a great opportunity. What I will say is just related to this funding, I know this is a question that a lot of people have had. Through the Dental Transformation Initiative, those community dental health workers did not stay in those programs. However, many of those FQHC partners received community health workers through the CCR grant. So while there was about a year of difference, and it usually wasn't the same staff member, they did have another allocation, although that is not specific to dental any longer. It's more broad, and initially many of those partners used their community health workers for COVID response. They're now moving into chronic disease management. And to my knowledge, they aren't using them for oral health at this point. So we can move to the next slide. I wanted to talk about the integration of our community health worker. So as I mentioned, we hired a half-time community health worker who filled the position in November of 2023. So if you're doing the math in your head, it's only been a couple of months, so they're still very new, which is why a lot of this is speculative, and why when we reorganized our team, we decided that myself and a community health worker were going to be a good fit. So for staff goals for our community health worker included supporting the Dental Health Network, or our coalition, to recruit and support the membership. Community education, so going out to present to community organizations, to provide trainings, to do tabling events, social media education, and prepare and edit written educational materials. It was important to us that the staff member was also bilingual in Spanish, which we are fortunate to have. We also are looking for the staff member to support COA education and outreach to school districts, as well as dental offices, and then to support our school-based screening and referral project pilot, which we have locally here in Sonoma County. And I see one of our community health workers who participated in DTI is here, which is amazing. I love that, to see that. So maybe Gustavo can add a little bit more, since I was not on the dental team when that project was actually funded, although I was peripherally hearing about it. Maybe Gustavo might have a little bit to add about that. So again, it's very much speculative at this point, because our team member is still only a few months in, and is working part-time. Both of us work part-time between both our oral health and our tobacco programs. So it's a lot of transition. So we'll just move to the final slide, which is Just a question slide. I'll put my email into the chat in case people have questions or think of something after the meeting. I know that often happens to me where I think of a great question as soon as the meeting's over. So I will add my email into the chat, and I'm happy to answer any questions in the larger Q&A.
Wonderful. Thank you, Ariel. Thank you to all of our presenters. We have some time for question and answer. And when we before we kick that off, we wanted to launch one more poll, which is how care coordinators and community health workers / promotoras / representatives assist with your oral health work plan activities. So Cindy, if you can launch the poll, we have some suggested answers or responses, and you can respond with what you have in place right now, and then we can also look at have a discussion too about how you foresee the this type of care coordinators supporting your oral health work plan activities.
Lindsay, are you able to launch the poll? I'm having some trouble. It says it has already been launched.
Oh, is it already showing? I'm not seeing it. No, I'm not able to launch it. So
Okay.
it looks like there's a technical glitch with launching the poll. So we'll skip that for now. And then Cindy, if you do find a way to get it up, we can dive into the Q&A and then come back to that. Oh, here it goes. Perfect.
There it is.
Okay. All right. So here's the question. How do care coordinators and CHWs assist with your oral health work plan activities? You have presentations, outreach to families, referrals, prevention strategies, other, or do not use. And don't know is also an option. And as you're filling out the poll response, if you have any questions that you want to ask out loud, you can use the raise hand feature. We can also check in on how the questions in the chat are going, and if there are follow-up questions, or if you haven't had a question answered yet in the chat that you would like to ask the presenters.
Lindsay, I got a private question in the chat that I think might be of interest to the larger group, if I could just speak to that.
Okay.
One question I got was how we're funding our community health worker. And this is a funded position in our LOHP grant. So we're using the money, the Prop 56 money, in order to fund that position. It was something we were able to work out in our budget. And so I just mentioned that then that's the model that we're using. So just wanted to put that out there since it wasn't available in the chat for everyone to see.
Great, that's helpful. Thank you. The funding question is always helpful. All right, so thank you all for your responses to the poll. It looks like 60% of people who responded do not use care coordinators or CHWs at this time. And of those who are using them, it looks like outreach to families is the top response, followed by referrals. So it looks like there's some opportunities there. So we want to open it up now to any questions that you have for the presenters that you haven't had answered already in the chat. We also, I know there's since there is so much activity in the chat, I believe there's some groups that help sift through all of that and send out the information afterwards. So I think that will be part of the follow-up materials that go on the COTAC website. So any questions to kick us off for the presenters? And I know one of the questions for the group, and I'm not sure if it's already been addressed yet, but we were wondering how many of you have already contracted with your local managed care plan for the CHW benefit, and if you are providing Medi-Cal services in the community. So if anyone is doing that who wasn't part of the presenters, we would love to hear more about if you're doing that work.
And I'd also just want to add, if there are contacts that folks would like to have with their particular county plans, the dental program is always happy to make those connections. So as a matter of practice, just with our Medi-Cal our Medi-Cal contracts for our managed care plans, they do have the APLs that do go out to all of the providers. So all providers did get a copy of the APL per our contracts. So it is one that does have that information, but I think for the connection of like local oral health plans to be able to connect with the plan specifically, we're always happy to make those connections. And again, just a very big kudos out to the additional panel members who are just making it happen day to day already. It's amazing to hear the work that's getting done today.
Thank you.
I just wanted to say, I'm really interested to know also, any other folks that are providing the service, if you've been able to start billing for this. You know, we're really looking to try to understand the sustainability of it, the costs, and how that's going to work out for us. So love to hear from anybody else who's doing that, either offline or here. And also that whole certification process. Somebody asked that question. And so we're really waiting for HCI, but as we're waiting for that to happen, we're relying upon what our community promotoras have been doing for, like I said, over 20 years. They have a core training by which they certify people. El Sol was mentioned, community colleges. So right now, as a supervising provider, I'm signing off on certifications based upon that. And we're just waiting for, you know, the guys from DHCS and HCI to be able to submit our curriculum and hopefully, you know, be approved as one of those that will meet the certification requirements.
I just wanted to lift up from the chat, Lindsay, if it's okay, because this question came up last week as well. And maybe this is for you, Adriana, but how can local oral health plans find out who their Medi-Cal managed care plan representative is? So I'll just pick out, like, for example, Sonoma County working with Partnership. How would they find out who at Partnership they need to connect to?
So I'd say the best conduit at this time would be dental program for the local oral health plans. Given that many of these corporations or these plans are very large with their infrastructure and who their staff are, it can really depend whether it's a policy or an operations person. So it really just depends on what specifically the local oral health plan is looking for connection. And whoever that is, we will do our best to make sure that those connections happen. So I would just say to contact dental@dhcs.ca.gov. And whatever county it is, we will definitely track it down to try and make sure we find the best contacts for the LOH piece. Thank you.
Great.
And also, I just want to make sure there's one point of clarification as well for especially when it comes to the specialty certificate for oral health. We have not formally committed to a quote specialty certificate for oral health. It is something that we are looking into, but it may be something more aligned with how we do, for example, like our CRA treatment, where there is a training that is put on in order to bill for the service, but not necessarily that there is a specialty training certificate associated with it. So I think that that's part of what we're looking at in collaboration with our stakeholders, partners, including HCI. And so I would say that the department definitely will have curriculum for the CHW, specifically for the oral health space, but how that looks and develops is currently underway. So just want to make sure that part's a little bit more clear for everybody.
Thank you.
Thank you.
I also wanted to ask, so I know we had for the poll, there were 60% of people who said they're not using care coordinators or CHWs. Are there any questions that you have about considering working with care coordinators and CHWs? I know there was a lot of great information presented today, and if this is something you're considering but haven't dived into yet, what questions do you have? Lori, go ahead.
Hi, do you know if when we're in the Eastern Sierras and everything is really spread out. So the problem is for reimbursement for us is there's so much travel time. So it doesn't end up being realistic for us to use a community health worker. Do you know if there's any kind of special billing for travel time?
So we do have travel services that are available for our members. So instead of the provider coming to the member going to the provider. And that is provided through non-emergency medical transportation as well as medical transportation services. In addition, one of the questions that came up during the chat was in regards to the telehealth provisions. And for telehealth, it is not per se precluded from the CHW policy. It just needs to be in compliance with, I believe it's section 2 of the provider manual. So that might be an alternative, just ideas, in a way that CHW benefit could potentially be effectuated.
Yeah, we've considered that, but we just have a lot of there's a lot of different dynamics. And I'm sure it's a lot of you other rural health organizations have the same thing. Yeah, a lot of people just don't have the time to travel that far. It could be up to an hour and a half. They can't take the time off from work, and etc. So, but thank you for your answer.
Thank you.
And Lori, is telehealth feasible, or are there internet issues?
The telehealth would require us, we are actually looking into telehealth. We're trying a lot of different things. We're trying to figure things out. A lot of people are actually snowbound for a good chunk of the year sometimes, and it's we have a lot of factors. So we would have to get to them, and there again, the CHW wouldn't be the person. It would probably be me with an RDH. So yeah.
Yeah, thank you.
We have a lot of people who need medical care or just someone to check on them, make sure that they're still doing okay. They have food in the house and they have their prescriptions. And that's why we would love a CHW, but it's the travel time. So.
That's good feedback, Lori, and we can definitely look into that just to make sure that I'm considering all potential avenues for that. So if you could email the dental@dhcs.ca.gov inbox, we can definitely just confirm to make sure that we've contemplated all things, because there may be something. The one that comes to mind is case management, potentially, if the needs of the member are there specifically through their MCP plans. So I think there might be more to come, or maybe a little bit more discussion on that dialogue for sure.
Thank you. Can you put that email in the chat for me, please?
Yes, you bet.
Thank you.
Thank you, Lori. That's a really important perspective. Celia, would you like to chime in as well?
Yes, I have a question regarding the supervising dental. Is it a supervisor that needs to be a DDS for billing purposes, or can it be a medical officer? We only have a medical officer at our LOHP. So we're trying to navigate how to get an MPI for extra help RDH and possibly do a community health worker for billing purposes to supplement for care coordinating and etc. I was asking Santa Barbara or Sonoma, do they have a DDS supervisor or medical officer supervisor?
So actually for the CHW benefit, because we are not providing treatment and it is not a dental benefit per se, we do not, we do not have a dental officer or a medical officer. We're just a community-based organization. And so that's not part of what the requirement is from DHCS for that benefit. So it's very different from a lot of the other traditional benefits that are offered through Medi-Cal and through Medi-Cal Dental. So there is we are the supervising provider. So the agency, the organization, is the supervising provider who does the billing. And our MPI number is not based on having a physician or a dentist that's overseeing the work. And that's just specific to that taxonomy that we have and the MPI that we have. So, and that's all, we're limited to just doing that piece.
And we don't do any billing, so I wouldn't be the best person to answer that question.
Okay. Anyone else want to chime in on that question about supervising?
I think the only thing I would just add is there are many ways in which that benefit could be effectuated, and hearing from Santa Barbara's particular perspective. That was an amazing presentation, by the way. Thank you so much. I learned a lot from how your county is doing business. So that's fantastic. But I would say for the medical component, we do have the billing for the CPTs. I put a little bit of facts and some hyperlinks in the chat in case you're interested in learning more about that. And then for the supervising DDS, that is something that is not quite available yet through the CDT codes because they need to essentially have that state plan amendment. And so once those CDT codes come live, that will be something that we will, of course, socialize out to folks. But again, that's just another way in which this CHW benefit could be effectuated.
Thank you so much. We have time for one more question if anyone else didn't get the chance to chime in yet and wanted to ask our presenters any follow-up. Okay. Great. Okay, well, we will transition to our wrap up. And before we do that, I wanted to see if you're in a place where you can turn on your cameras. We'll give everybody a few seconds to turn on your cameras. We've done this before, but it's especially timely today. And in light of the connection between oral health and heart health, we would just like to thank our presenters and also would like to thank our planning team. Again, we mentioned them last week, but Henry Torres, Jennifer Fusetta, Aya Ali helped put on this event, and Karen Jacoby, Peng Vang at the Office of Oral Health helped spearhead the planning. So we would like to show all of the presenters and planning team some love. So if you can just start shaping some hearts with your hands. We're gonna send some hearts to our presenters. Thank you so much for the excellent work. Let me see, I think there's one to remember this one. Okay. Oh, it's lopsided. Okay, thank you. Oh, it's so great to see everyone. Love it. Thank you for the excellent presentations and all the great emojis. Miss seeing everyone in person too. So, all right, we're going to transition to our wrap up. We have a few more minutes and then we'll close out for the day. We didn't want to leave you without a next step. So we have a results-based accountability training coming up on April 4th from 9 a.m. to 12 p.m. I think Cindy has a slide that she'll show. So that will give you our next chance to see everyone. So the benefits of this training are about peer-to-peer collaboration, improving COA reporting, increasing COA engagement, and participating in a quality improvement project. So more information will go out about that. Cindy is pasted the website in the chat, and I think might also show a slide if it comes up. But we hope this has been a helpful overview of school dental programs, both part 1 last week and part 2 today. Today really focused on how you integrate care coordination and opportunities for working with community health workers, promotorists, and representatives. So here's the details about the RBA training in case you need to see it visually. It looks like spots are limited, so the sign up link is in the chat, and that would be the next gathering on April 4th. We're also starting to discuss the next PDM, which will likely be in June. So you'll be notified as soon as we have the date for that. And as we mentioned at the beginning, we do build the meetings with help from an LOHP work group. So if you are interested in volunteering for the June PDM work group, please send your program consultant an email indicating your interest. And we look forward to seeing you then. We will do one more thing, which is drop the evaluation link in the chat. You will also be getting the evaluation emailed to you. We would love your feedback. It's really helpful. And it looks like we have one more comment from Ariel. Go ahead.
Yeah, thanks, Lindsay. Regarding this results-based accountability, since it's a peer-to-peer collaboration, can you share, is there an intention to have additional meetings? So if you come to this meeting, should you anticipate additional meetings, and just considering that in your schedule?
Good question. Kristen, did you want to take that?
Sure. So I think this first one is the overall training. And then if you have not already taken the Learning Collaborative, you would join a cohort and have a couple meetings over a longer period of time where you have sort of take-home homeworks and then work with your group to present it back and get feedback. I think we've had about a third of the LOHPs go through a Learning Collaborative so far, so we're really hoping that the rest of you are able to sign up in this new round. If you go to the website that was linked, there's a video from some of the LOHPs who have taken it before, and you can hear from them some of the benefits from participating.
Great. Thank you. Great question. All right. Wishing you all happy hearts, good oral health today. And we'll see you at the next one. Thank you all so much.
Thank you.